A new task force is giving itself 6 months to make a dent in the rising drug problem in La Crosse County. News 8's Pauline Lee joins us live in the studio with a closer look at what they hope to accomplish.
Well, this new task force is a direct result from an open meeting held last June that really pushed the heroin and opiates problem into the spotlight. Today was the group's first official meeting, and now the hard part begins, narrowing down a focus and making a difference. It's not a new problem in our community, but La Crosse County Sheriff Steve Helgeson says it's getting worse.
I think it's just more pervasive than it's ever been.
In the past several years, more people are getting addicted, arrested, and even dying from heroin. In 2000, the county recorded 3 deaths related to heroin overdose. 10 years later, that number quadrupled and has stayed about the same ever since. La Crosse's Tri-State Ambulance has also increased the use of Narcan by upwards of 25% each year just to treat people who have overdosed. But law enforcement alone can't solve the problem.
It's very difficult. We have limited resources, and the problem is extensive. We're seeing kids in teenage years all the way up to retired persons using heroin.
In order to make an effective impact on it, we can't just focus on one area or one spot.
That's why this room of county leaders, educators, medical experts, and law enforcement have formed a heroin illicit drug task force to help make a dent in the issue.
Whenever you get a group of people together that have a lot of experience, have a lot of expertise, and you really try to focus in on one area, and then you get backing from the county, from the community, we can make a difference.
For the next 6 weeks, the group will look to create change by developing and implementing methods of intervention, prevention, or law enforcement. But whichever route they choose, Helgeson says something needs to be done.
We need to make an impact. We really need to take a look at what we can do to try to save some lives.
The group's next meeting is in 2 weeks, where they will take a closer look at data from the hospitals, first responders, and law enforcement to get a better idea of the problem in our area. They will then decide whether just to focus on heroin or also include things like meth or other drugs, since a lot of the time these problems go hand in hand.
All right, thank you, Pauline. If the group is successful in making a difference in 6 months, it will then look to additional resources to keep moving forward.